Hi, this is Chen with Richmond Plastic Surgeons. I'm here to discuss breast reductions today. It's one of my favorite procedures in that it's both a cosmetic as well as a functional operation. The first thing about breast reductions is that it takes care of large breasts. It will reduce the size. The secondary benefits are it will oftentimes take care of the associated neck, back, and shoulder pain that women have with having large pendulous breasts. Typically, with a breast reduction, the usual incision pattern is called a WISE pattern. That's an incision that goes around the nipple-areolar complex, straight down and underneath the shadow of the breast. There are ways to decrease the length of that scar, but it all basically depends on the patient's anatomy and how much breast tissue is being removed. These procedures can be done for both cosmetic and reconstructive reasons. Insurance coverage for breast reduction, like I said, depends on symptomatology. A, you have to have large breasts. B, there has to be the symptoms, neck, back, and shoulder pain, rashes underneath the breast, etc. This operation takes a few hours. And it's, like I said, it's one of my favorite operations because the patients are so happy afterwards. Besides taking care of the neck, back, and shoulder pain, it also helps give them a more youthful contour of the upper torso. Having large breasts and having to buy shirt sizes 1 to 2 sizes larger than pant size is kind of cumbersome for a lot of ladies, and also it's a very matronly look. The downsides for having a breast reduction are that you will have a scar on your breast. There is a small percentage of women who will become insensate in their nipples. It's in the low single digits, but it does happen. And then the other possibility is if a woman is younger and she has children, she may not be able to breastfeed. That being said, I have had the pleasure and the privilege of operating on many women here in Richmond, and I've found that the daughters of the mothers that I've operated on are coming in at an earlier age, because the old dictum used to be that women should wait until they're done having their kids, etc. And because that can get stretched out 20 or 30 years, the patients who've had breast reductions, they don't want their daughters to suffer for the many years that they did. So we see them as soon as they're at a stable height and weight and they finish growing. I think it's a great operation, and it really helps our patients really achieve the look that they want, as well as improving their self-esteem.